Okay, corneal edema. Overview. Description. The corneal stroma is composed of laminar sheets of collagens interspersed with abundant osmotically active mucopolysaccharides. Without the pumping actions of the endotheliums, and to a lesser extent the epithelium, the corneal swells and the normal orientations of the lamellar collagens is lost, leading to decreased corneal clarity. Edema of the epithelium increases forward light scattered and has a greater effect on vision than stromal edema. Causes. Corneal edema is most often a result of endothelial cell dysfunction, although it may also occur from epithelial and stromal disease. In addition, it may result from breaks in the descemet membrane as occur in corneal hydrops. Endothelial cell dysfunction occurs for a number of reasons as discussed below. It could be hereditary endothelial dystrophies such as Fuchs endothelial dystrophy or congenital hereditary endothelial dystrophy and posterior polymorphous dystrophy. Inflammatory. Herpes simplex and herpes zoster keratouveitis can both lead to significant endothelial dysfunction and corneal edema. Intraocular pressure. A very high intraocular pressure, greater than 50 mm per mercury, as seen with acute angle closure glaucoma, typically lead to microcystic epithelial edema, while a low pressure, less than 5 mm per mercury, typically lead to a deep stromal edema. Symptoms. Corneal edema leads to blurring of vision, increased glare, photophobia, and halos around light sources. Microcystic epithelial edema also leads to a gritty foreign body sensation. Rupture of an epithelial bolus leads to an acute painful episode that typically lasts for several days. Signs. Epithelial edema. Accumulations of fluid both within and underneath the epithelium leads to microcystic epithelial edema and bullae. Microcystic edema gives the epithelium a roughened, uneven appearance, while bullae appear as raised area of epithelium with negative fluorescein stain. Stromal edema. Accumulations of fluid in the deep stroma leads to characteristic folds in descemet membrane and generalized opacifications of the stroma. Associated signs that can help to identify the cause of the edema are evidence of previous intraocular surgery, endothelial catarrhate, intraocular inflammation with keratic precipitates, and abnormal intraocular pressure. Management. The underlying cause of the edema should be treated. This is especially the case with desciform keratitis. The most common cause of gross corneal edema are post-surgical or dystrophy. In such cases, irreversible endothelial dysfunction may be treated with the measures discussed below. Tear supplements. Lubricants can reduce the grittiness and foreign body sensation of microcystic epithelial edema. Therapeutic. Hypertonic saline drops and or ointment can be used to osmotically desiccate the corneal epithelium. They have no actions on stromal edema. Right.